that right? Excellent. Thanks.
Change the slideshow first. I was previewing your show.
Yeah, you took it right to the end.
Right to the end. Let me get started at the beginning. Okay. Joining us today is Eric Kennel. Eric is the Executive Director of Compass Mark, a nonprofit organization with a mission to prevent addiction through education, skill building, and community mobilization. Compass Mark's team of dedicated staff serve over 10,000 children, youth, and adults each year throughout Lancaster, Lebanon, and Chester counties. In his role, Eric leads Compass Mark's work to educate our community about the disease of addiction, connect individuals with treatment and recovery support, and expand evidence-based prevention programs for youth. Eric holds a Master's of Public Administration degree from Penn State University and currently serves on several local boards and community coalitions, including Lancaster County Joining Forces, HEAL PA, Lancaster County Reentry Coalition, and the DUI Council of Lancaster County. He also serves with the Pennsylvania Prevention Directors Association. Welcome, Eric.
Okay, great, thank you. Well, thanks for the invitation to be here. I'm recognizing that it is a rainy Friday, and yes, there's good sides of the rain, right? But some of the information and data that I'm going to be sharing with you is heavy. Addiction is a heavy topic. It can relate to many of us in different ways. But what I want to convey here too is that there's a lot of hope and there's a lot of progress that's being made. Some of you may have seen recently the national overdose death rates are going down. That was just reported, and we're seeing a lot of positive changes here in Lancaster County also related to that. So I want to talk a little bit about that and just share some of what we're doing in the prevention space right now at Compass Mark. You already heard a little bit about the organization. So we are a nonprofit. We're up in Manheim Township is where our Lancaster office is. We reach over 10,000 individuals each year. Some of you may have known, if you've been in the community for a while, we were the Lancaster, the Council on Drug and Alcohol Abuse. People knew us as the Council. And it was about 10 or 15 years ago that we changed the name to Compass Mark, but some people still refer to us as the Council. I want to start today with a little story. Once upon a time, there were some fishermen that were sitting along the river. Suddenly, they noticed somebody coming down the stream, struggling for life. So they did what every responsible citizen would do. They threw them a life preserver, pulled him out of the stream, and then they looked upstream, and there was another person coming down the river. So they did the same. And they did the same. And throughout the day, they just kept pulling people out of the river, and it got really exhausting. So they decided to take a little walk up the stream, and they said, what's going on here? Why are so many people falling into the stream? So they discover up the river a little ways that there was this steep cliff, and people were being drawn to the edge of the cliff. They were looking in, they were falling in, and that was the reason why so many were getting carried down the river. So what did these people do? They decided to get together in their local community, organize people like yourselves who are committed to making change in the community. They started to educate people about the dangers of the cliff. They started to teach them how to control their impulses, to make good decisions. They even gave them some healthier opportunities of activities to do to cope with their stress. They even started doing some public advocacy work and changing in public policy related to the cliff and how setting some guardrails up around that. So here's a picture of the fence. So after this, they went back downstream and noticed that they had significantly reduced the number of people falling into the river. Still, occasionally would find somebody coming down and they would pull them out, but as a result of their efforts, the community was much better off, and obviously many people were saved through that process. So hopefully, even if you don't enjoy fishing or whatever, you can appreciate the message behind this story. It really captures the essence of what we're trying to do in prevention, which is working upstream, addressing some of the root problems and root causes of our problems, and that's what our team does at Compass Mark every day. One of the groups that I'm actively involved with here in Lancaster, John mentioned, is the Joining Forces, which is a local coalition of community partners that has come together to address the overdose epidemic in the community. It was started, I think, back in 2017 by Commissioner Josh Parsons and now his fellow commissioner, Alice Yoder, when she was at LGH. This Rotary Club actually made a very generous contribution, if you remember, a number of years ago, to the work of Joining Forces. And Compass Mark and some of the programs and services that you're going to hear about here were a beneficiary of that grant. So we just wanted to say thank you to this club for that contribution, and appreciate the support that you're all providing to the work that we're doing in the community. From day one, Lancaster County Joining Forces has been very focused on two things. One is monitoring the data and effectiveness, and using effective strategies to address the crisis. So the steering committee just met this past week, and so some of this data that I have here on this slide was just presented on Tuesday. And what you'll see here, a couple things I want to highlight. Overdose deaths in Lancaster County are on a steady and significant decline. You'll see there 2017 was kind of the peak of the crisis. We had 168 people that were lost to an overdose during that year in Lancaster County. And if 2024 continues, we're going to potentially have the lowest rate in a decade. And so there's a lot of hope in this, and there's a lot of evidence that the efforts that we're doing as a community to address this are paying off. I mean, there's still too many. Obviously, any life lost is still too many to an overdose, but there's a lot of great work that's being done by many community partners. A little bit about the substances that are contributing to the causes of death. You know, early on in this, it was primarily heroin and opioids. Now, more and more fentanyl is being introduced. It's a much more lethal substance, and but you'll see there the comparatives from 2023 to 2024 across the board. We are seeing reduced numbers. The number that's we had some conversation about it at the meeting, actually, is the opioids non-fentanyl there. You see there's a big spike in 2024. And this data comes from toxicology reports. And so opioids non-fentanyl, you see almost doubled so far this year. And this would be things like oxycodone, Vicodin, codeine, morphine, medicinal kinds of opioids that are getting diverted, and unfortunately people are overdosing on. So that's an area of concern that we're looking at, trying to get ahead of that. Yeah, go ahead.
Is it because we're better at understanding how to treat overdoses, like with Narcan and stuff like that, or is it low use as well?
That's a great question. I don't know that we have a certain answer to that, but we do recognize that a lot of the efforts with Narcan, with just increasing the capacity of the treatment system. I mean, there are providers doing medication-assisted treatment now in all parts of the county, where, you know, in 2017 there just was not those resources available. So I think people are getting into treatment quicker, but yeah, as far as actual use, my sense is it's probably not declining, but it's really just that people are getting into help quicker, if that helps. Here's some data around national, state, and local comparisons. So Lancaster County, we are the blue line there, and again, there's a lot of progress that's being made in Lancaster County specifically to reduce those overdose deaths. And so you'll see there we are significantly below the state and national trends as far as death rates per 100,000 people. So that's great to see. And this is, again, another chart looking at the trends, and you'll see there in Lancaster County, over the course of last year, we had a 20% decrease, and actually going in now into 2024, it's about a 40% decrease in overdoses. So it's very, very, very encouraging. But like I said earlier, any death or any person lost to an overdose is something that we want to try to address and provide those resources and support. So now moving just a little bit into kind of Addiction 101, I just wanted to share a couple things. When I first got started in this field about 8 years ago now, I guess, one of the most significant things for me learning about this work was in the neurology of addiction. And, you hear people talk about the reward pathways in the brain, and recognizing that there's actual physical changes that occur in the brain of a person who's dependent on a substance. And so, really trying to change, we're really trying to focus on helping people understand addiction as a chronic disease of the brain. It's, many ways just similar to diabetes, heart disease. These are things that require treatment. They require ongoing maintenance to manage them and manage them effectively. And you think about how would our response to substance use and addiction be different if we viewed it in the same way that we do a physical disease? Certainly, a great example of how we've kind of been able to change some of the understandings of how we address addiction away from a punishment kind of mentality into more of treatment rehabilitation. A great example of that is the Second Chance program, which was started here in E-Town by your former chief of police, and Blueprints was really a program that was designed to identify individuals who had possession of drugs and getting them directly into a treatment program as opposed to incarcerating or locking them up. Many people also refer to addiction as a family disease, and it affects so many people around the person, and that can be a really challenging thing for people who are navigating with a loved one. The other thing I want to just mention here too is that addiction thrives in isolation, and the Canadian doctor Gabor Mate, if anyone has heard of him, he's done a lot of research and writing on this kind of idea, and he talks. A quote that I'd like to share with you here. He says that addiction is not a choice that anybody makes. It's not a moral failure. It's not a weakness of character. It's not a failure of will. What it is actually is a response to human suffering. It's an attempt to escape suffering. And he goes on and talks about how, addiction many times is a place where we're trying to fill a void. And so, we turn to something external like a substance to fill that void. It's a really interesting way of thinking about this, and it also helps to change, the blaming and the guilt that so many people have related to this topic. It helps to just put that in a different light. The other thing here too is that this idea of working upstream in prevention was around understanding risk factors, and how many times have we wondered why there's one person who can go, out to a bar on a Friday evening, drink 1 or 2 drinks responsibly, have no problem with it. While for another person, that 1 or 2 drinks can turn into 4 or 5 drinks. It can turn into every night, and it can turn to suddenly a situation where, their family is being harmed, their employment is at risk. And so what is the difference? Like, why is that between one person and another? And the truth is that risk for addiction really is a very complicated thing. We know that over 50% of our risk comes from our genetics, things that we can't change about our family history, our DNA. The other 40%, roughly, is our environment. And this is where we really focus in prevention at Compass Mark, is those environmental factors, things that we can change. The experiences of our childhood, our socioeconomic condition, our social involvement, community supports, our ways of dealing with stress, Those are all things that we can change and we can help people develop skills for. Some of you may have heard of something called the Adverse Childhood Experiences, ACEs. There are 10 ACEs that have been identified related to abuse, neglect, household dysfunction, basically experiences that any of us could have in our childhood. And when they are experienced as a child, they can contribute to toxic stress and they can actually impact the brain of a developing child. It's estimated that 1 in 8 adults have 4 or more ACEs. People that have 4 or more ACEs are 12 times more likely to commit suicide, 10 times more likely to inject drugs, 7 times more likely to abuse alcohol, and they have a much shorter lifespan. So the more I started to dig into this information, this research, the more convinced I became that upstream prevention is really the solution when you start to see some of those risk factors and where they come from. So what is effective prevention? There's a definition here at the bottom that I love to share. It's probably the best definition I've found for what prevention work is all about. It says that prevention is a proactive process that empowers individuals to meet the challenges of life by reinforcing conditions that promote health behaviors and lifestyles. There's a lot of things in that definition, but really decades of research has shown us what works in prevention. And I'll give you a hint, the DARE program, which many people think of when they think of DARE, think of prevention, that was not something that actually worked. DARE was built on a lot of scare tactics, a lot of emotional kinds of responses, and you think about the ads of you're frying your eggs in a frying pan, and it's like this is your brain on drugs. Like that doesn't change people's behavior. That doesn't change their even their understandings of drugs. What does work is skill building programs, teaching kids to cope effectively with trauma, with stress, giving them opportunities to connect with each other. And really what's important in prevention is that you got to start early. The earlier you can begin with prevention and then build it out across the lifespan, that's when you're going to see the most results. Just a quick data point that really illustrates that. 70% of people who try drugs before the age of 13 will develop an addiction within 7 years. So 70%, before the age of 13. So that just goes to show, when we work early with kids, when we give them information, give them resources at an early age, we really can impact that possibility of them getting a substance use disorder later. Here's some information that comes actually from the Pennsylvania Youth Survey. This is a data source that's used across the state. School districts participate, or they can choose to participate in this data collection. It's done at the 6th, 8th, 10th, and 12th grade levels. Locally here, both Donegal and E-Town school districts both participate in the PAYS, so their data is included in this. This reporting is for Lancaster County as a whole. A couple things I'll point out there. On the alcohol here, you'll see rates of use or reported use from youth at a lifetime. In their lifetime, among 12th grade, we've got about 37% of 12th graders reporting that they have used alcohol at some point in their lifetime. 18% of 12th graders are reporting use of marijuana. And these charts have actually changed because it used to be alcohol, marijuana, and cigarettes, right, were the three things. Now vaping has become actually more prevalent than traditional cigarette use, e-cigarettes. And you'll see there about 17% of 12th graders report vaping, replacing cigarettes again, like I said. But the other thing I point out in this data is that the trend is going down. If you look at this, this is 2019, 2021, and 2023 data. So you can see there that among 12th graders, that highest bar is the 2019 data. And the numbers are going down. So that's showing that there's fewer kids who are using substances. And like we talked about, that's a good sign for the future because we know that as kids at an early age, if they ingest substances, it does create a greater likelihood of developing a substance use disorder. Yes. Oh, great question. So yeah, that is a federal data source called Monitoring the Future. Yes, so the circles are state and the little triangle is national. So again, you'll see Lancaster County's data is generally we are lower than both national and state averages. Yeah, thanks. The other thing I want to point out here too is in this interplay between mental health and substance use. We talked about how substances are often used to cope with stressors and anxiety. Youth today are reporting mental health concerns at a rate that's unheard of. And, you know, there's a lot of discussion around what that's all about. Social media, perhaps, many, you know, some of the isolation that happened during COVID. There's a lot of different explanations for why that is. But for many youth, suicide and mental health is a huge area of concern. And school districts are telling us over and over again, we need to help these kids. This chart really shows the connection between substance use and mental health. You'll see there on the far right, these are youth who are reporting high depressive symptoms. So among those youth who are reporting high depressive symptoms, 47% have used alcohol, compared to the 12% who are reporting no depressive symptoms. Similar to marijuana, 22% with high depression are reporting using marijuana, compared to just 2% of those who have no depressive symptoms. So kids are using substances as a way to cope and to self-medicate, and that's a concern. So what are we doing about it? This is where we get to talk about the positive things. Risk and protective factors. Well, first I'll just say this. This is also from the Lancaster County PAYS, the Pennsylvania Youth Survey. And this gives you an idea of what are some of those risk factors and the protective factors that youth in our county have to address substance use. So some of the primary risk factors, the highest there is a low commitment towards school. So some of the programs that we're trying to do is trying to help kids connect better with school, with their administrators, with their teachers. Low neighborhood attachment is another area where we know that if kids feel more connected to their community, if they have opportunities to engage in good, healthy activities with their peers, it makes them feel like connected, and it makes them feel like they have a sense of place. And that is an area that we're also looking to do more in to address that risk factor. And then the protective factors are the good things that you know that really help to protect kids from a substance use or mental health issues. Family is the biggest thing for a child. A strong family unit that supports that child. Opportunities for pro-social involvement. That just means, again, community activities and rewards and recognition also, which, you know, I think like your scholarship programs that you all support at Rotary, that is a great example of giving kids rewards and opportunities and investing in that. Belief in the moral order, that's a typo there, not the mortal, not the mortal order. I just caught that now. The belief in the moral order, that kind of gets to the role of religion and other kinds of codes of norms and conduct in the community. And so in Lancaster County, we have very high protection in that area also. All right, so now we'll go to some of the programs that we're doing at Compass Mark right now in prevention. Schools are our biggest partner in prevention, and they are the door through which we're able to provide a lot of the programs that we do to children and youth. In the past year in Lancaster County, we were in 11 school districts with Compass Mark, both E-Town and Donegal. Actually, in Donegal School District, we are in every school up through high school with evidence-based prevention programs. We reached across the county about 4,000 students last year through these programs. There's different programs that we do based on age level. Some of them are called Positive Action, Project Towards No Drug Abuse, Support for Students Exposed to Trauma. We just started doing a Catch My Breath program, which is a vaping education program. That's more for middle school. high school age. A lot of good programs. Some of you may know Gail Viscombe with the E-Town Communities That Care. She's doing a lot at the high school level in E-Town District, also in prevention programs. And really, these programs, they're designed to give kids skills, help them resist peer pressure, again, how to cope, build supportive relationships and communication skills. We also have a couple community programs that we've been doing for many years. We have a Leaders of Future Generations, which is a mentorship program. And recently, we've started to partner with the county DA's office and Blueprints on our Skills for Life program, which is a diversion program. Some of the district judges locally will refer individuals who maybe have a citation or a misdemeanor charge. They'll refer them to our education class as a way to get some more information and resources for them. And their record is expunged as a result of their participation in that program. And then we also have a program that is called the Family Services Advocate Program, and that supports children who have a parent who's incarcerated at the Lancaster County Prison. Again, we know that those kids are at especially high risk and have a lot of needs based upon, again, that disruption of their family with having a parent in jail. So we're doing some supportive programs for those kids as well. And then we have an addiction resource center where we connect people to services, and we do a lot of training and technical assistance as well. So ways to help. I can't leave a venue like this without talking about opportunities to support this work. And I know this Rotary Club has been very generous in supporting this in the past. I think one of the biggest messages that I always try to communicate in prevention is just to share hope and give people an understanding that there are resources out there. You know, it's a hard conversation to have with somebody who's struggling with a substance use, but there is a whole community of people and professionals who are there and they are ready to help. And there's a lot of stigma in this field, but we want to try to reduce those barriers and just help people know that we're not going to be asking questions, we're not going to be blaming people. We just want to help. Another thing is that is promoting prevention programs. Like I said, you've already got good utilization in your school districts here in this community for prevention. The research shows that for every dollar that's invested in prevention, upwards of $20 can be saved on long-term costs. So it's much easier for policymakers, et cetera, to throw money at a problem and try to put Band-Aids on things. But if we're not working upstream, we're actually we're not winning that game. And so working ahead, trying to put those dollars where they can make the most impact is really important. So if you know of any community groups or whatever that would benefit from some of these prevention programs, reach out. The other thing I'll say too is just, again, avoiding stigmatizing language. This is something that I'm trying to be more conscious of as I talk about this. But the kind of the old way of talking about an addict or there's just labels that are associated with individuals that are experiencing a substance use disorder. So we're trying to change some of that stereotype and use person first language, like a person with a substance use disorder, a person in recovery. And then the last thing I'll say, and then I will take any questions, dispose of medications properly. I brought along here a couple of these doTERRA bags. This is something that we're doing. We're going to fairs and health events and stuff like that, trying to get these pouches out in the community. The number one way that kids are accessing prescription drugs is from their own home, the medicine cabinets. So locking up those meds, disposing of stuff that's not being used anymore. It's a great, simple way that we can all protect the kids in our lives. And so these pouches there's like a charcoal deactivation piece that kind of helps to. You can also take them to the police department and drop them off too, but it's a better way than flushing them down the toilet to get rid of them. So there's a couple things that you all can do and consider as ways to support the work that we're doing at Compass Mark. And yeah, I just want to highlight really that the work that's happening is making a difference. And it is a heavy topic. A lot of people impacted by substance use disorders and addiction. but we're starting to see progress, and that's really exciting to see. So I'll take any questions if any. I think we have some time. Yeah, I saw this one first. Go ahead.
You having any difficulty finding staff?
That is a great question. We have had a really good year at Compass Mark with retention of employees. That is we just did get some additional funding from our county for some of the opioid settlement dollars are going to be going into prevention. So we're hiring for new positions right now. But so those positions are open. But existing staff, no. We find there's a lot of people who are frustrated with public education and teachers, people leaving the teaching profession, and our programs provide them a way to still be in front of kids, get into the classroom, but not have to deal with all the other stuff that that teachers are getting burned out with right now in the schools. Yeah, go ahead.
So in my, as I look at things, most of this was for teenagers and adults. So what do you do when their parents are substance users and going back generations? Because as a nurse, about 45 years ago, our goal was pain-free. Like the medicine hospitals, like first of all, how much pain, you jacked up the pain medication.
Right.
So you're dealing with generations using substances. Mm-hmm. And so everything will do what they see their parents do or what their grandparents do. Do you have any services for the older generation?
There is a Joining Forces for Children actually is a program that came out of Joining Forces that serves children who have a parent that is in substance use or dealing with substance use, and that's really designed, like you said, to try to stop it. And if that's the only example in that child's life, they don't know any different. And so some of that work that's being done with that program is to help those kids understand that you don't have to follow the path of your parents, and there is healthier ways that you can move forward. So yeah, it's a great question. And I should have said too, a lot of these prevention programs that I was talking about, they are done at the elementary level. Like we're really trying to get in, kindergarten, first grade. You're not talking about specifics of drugs and alcohol at that age, but you're teaching them, how to regulate their emotions. You're teaching them the skills that they need at that level. So, yeah, good question. I saw yours here.
If I can recall this correctly, you had mentioned Donegal School District has prevention programs in
Yes.
at every school level.
Yes.
Is that because Donegal School District has a higher prevalence?
No, not necessarily. I don't actually have data at the school district level around use. That PAYS survey data, schools do get a copy of their results, but it's not something that's public information. But Donegal is a school district that has they've seen the need, and they've said, hey, we would love to have you come in. I can tell you that there are a lot of districts around the county where we know that the needs are great. And Donegal is not one of those that we've identified as needing that support, but the school district is saying we need these programs, and so we always come in at the invitation of the districts. So yeah.
Are you seeing a association with more rural-based school districts compared to the more city-based school districts when it comes to the prevalence?
Not necessarily. No, and that's an interesting question because you look at some of the states that have been just devastated by the opioid crisis. It is more rural communities generally. West Virginia is a state that has had a lot of challenges, and so kind of the initial thinking was that maybe this is more of an urban issue, but that's not necessarily true. But again, it has to do with those risk and protective factors and where those exist. Those communities generally are stronger. Yeah.
So a natural question for me, and you didn't say this, so maybe I'm reading
to it, but you did say Donegal has you in every.
Last year they did, yes.
So why wouldn't other school districts? I assume, by the way you said that, E-Town doesn't. Why? What's the holdup, or what's the preventing it from being in every?
Yeah, I get really bad.
Maybe this is an answer for that, but Greg Keel, who is the superintendent at Donegal School District, was a board member on the Elizabethtown Area Community Care Board
Yeah.
for many years, and now he is superintendent of Donegal.
Yeah, and I guess I should say too that I'm not saying that E-Town is not doing good prevention, because they are. They have, again, we're in most of the elementary schools, E-Town communities that care, but I think, yes, that issue, the biggest question or the biggest challenge that we find is getting us into the schedule of the school day, because with the expectations of teaching to the test and standards and all of those educational standards, this kind of curriculum and kind of health curriculum is just something that they have to find the time in the schedule to do, and so that can be a biggest challenge a lot of times. Sometimes it's politics, sometimes it's school boards that say that's not the role of the district, so that should be a parent thing. But other times it's just honestly it's easier for us to do programs at the elementary level than at the high school level, just because of schedules.
But even private schools, nobody's immune to this.
That's right.
So
Yeah.
And it's a little bit frustrating.
Yeah.
That it wouldn't be everywhere.
I completely agree. Yeah, these are life skills that we're coming at it from a substance use and addiction standpoint, but these are life skills that I think we all can have common agreement on are important for our kids to develop. Yes.
I think one of the things we also have to remember, I have a niece who's an addict on Jay's side, but she, we apply common sense to things we do. And when you're an addict, it's like there is no common sense. And just quick story. Her boyfriend was in jail. The day he got out of jail, she picked him up. They went to a drug dealer that he met in prison, picked up some stuff. She took it immediately, overdosed. He took her to the hospital. They revived her. They left, came home. He took the same meds and died on the floor here on West High Street. So you would think common sense says, these are bad drugs. But like Scott Dorr, I don't know if you know
Yeah,
Scott.
I know Scott well.
I think he explains addiction very well with just one simple analogy. When you eat a potato chip, you put that in your mouth, your tongue says, when you taste buds say, wow, that's really good, I want another one. He said, when you take drugs, he says every cell in your body then wants that drug.
Mm-hmm. Yeah.
So we try to apply common sense to it, and you can't.
That's right. Yeah, it's literally like a hijacking of that decision making in the brain. And those of us that have not experienced that, it's we can't relate, right? But that's a good way to describe it. Yeah.
About 6 years ago, we started to support joining forces our golf tournament every June, and part of the proceeds would go to that. I've been part of the planning team, and I remember on your website, I guess it's still there, that there are other organizations countywide, not just schools, but other organizations for all ages that are just countywide. Can you recall what some of those are?
Yeah, there was a lot of coalitions that formed, kind of community level groups that started. Some of that was because of the mayors at the time, Lancaster County Mayors Association. They were trying to, they were hearing all this from the community about we need to do something about these overdoses, and so there's a group in Lidditz that formed, ASAP Lidditz. The Donegal Substance Abuse Alliance began right around that time. E-Town, they've been the communities that care. There are community coalitions in almost all parts of the community in Lancaster that are doing kind of prevention and education work. So we're continuing to support them as an organization. Yeah.
Yeah, I know effort at Eastern Lancaster County.
Yes, there's some over there too.
I saw it as well.
Yeah.
And just one more thing regarding incarcerated parents and how the children, of course, are the victims in so many ways and easily swayed into abuse. Are you familiar with Facebook at our meeting a number of years ago, Swan?
Yes.
Scaling walls a note at a time.
Yeah.
Where these young kids, it's an after-school program that they get hands-on opportunities to learn instruments and music as incredible therapy for them.
Right.
Because you had asked if we know of services that would be, just wondering if you do refer.
Absolutely. Yeah, that's a great example of another prevention organization that's doing really important work in a really innovative way, right? Using the arts to give kids that sense of fulfillment, and yeah, that's a great program.
I think Matt had a question.
Yes, right here.
My question is trying to take our thinking a little differently. My question has to do with, you're talking about addressing primarily youth. Do you do anything in, like, for example, from maybe age 40 or 50 on, arthritis, injuries, and the prescriptions that are given for hydrocodone, Norco, and then the outcome of, well, you know what the outcome is, not all of that's positive.
Yeah.
Is there an organization like yours, or do you have a phase of that?
There is not a lot of work being done with that population, the adult population, in prevention, and that's actually a data point that we're concerned about. Is historically overdoses generally were like, you know, the 18 to 35 year olds. Those were the population we're most concerned about. But we're starting to see older adults now at a higher level, and we need to develop some programs and resources for them specifically. So yeah, I'm right with you. I'm aware of that, and that's something that I think we can do better. Yeah.
So would that be part of your mission, or is that another entity?
Yeah, I mean, potentially it's something we're looking at with our funding as to whether we can, you know, do those kinds of programs, expand in that area. But it's, yeah, I mean, certainly we will always want to say, like, look, early intervention is the best way to go. But when you start to get data that supports the need for services for older adults as well, like we need to pivot and make some changes. So yeah, thank you for that good reminder. We were running out of time.
It's called Rotary.
It's called Rotary. The solution, right?
So the people, you know, you do your outreach, but there's always people in the shadow. Do you have online resources where you try to draw them in to get to a person?
Yeah.
With the, you know, with social media and you know, all of those tools that are out there.
We have a website that has resources on there. Our staff, we really encourage people to call in if they're willing to, because our staff have a really good sense. We get a lot of calls for like a concerned family member who says, I'm really concerned about so and so. I need to have a conversation. I'm just not sure how to get them to want to get help. And so there's actual professionals that do kind of intervention work that we can refer them to. But yeah, we're trying to put more on the website as well, because that's an easy way that people can access information. Yeah. Yep.
My wife and I have been going to our local Elizabethtown school board for the last over 2 years, and we've heard board members and community members, and it's a major movement now among many schools. Keep the school out of my family. We don't support counselors. We don't support the social part. We'll take care of it. And so that movement of not seeing the whole system and caring about the kids that way is strong, and it's growing.
Yeah.
And I'm very concerned about that.
Yeah. It is challenging times. That's a dynamic that is changing, and we're quite aware of that. Yeah.
right, I think that's it. Thanks, Eric.
Yeah, you're welcome. Thanks for the questions.
Yeah.